Hello and welcome to another Feliciano Live here at the Feliciano School of Business. My name's Louis Beyond-Lillo, and we have a wonderful guest here today. We'll get to him in just a minute. But just a reminder, with all of our Feliciano Lives, if you have any questions about our topic today, feel free, put those questions right down in the live chat down below, and we'll see if we can answer as many of them as possible. And that goes throughout the entire live. So if we're talking about something, you're confused, or you want an elaboration, anything at all, just make sure, type those questions right down in the chat, and we'll be able to answer a few of them now. Today's topic, we're going to be talking all about how business analytics can minimize the spread of COVID-19, and that's all that we've been looking for as a society in the past 2 years, minimizing the spread of COVID-19. I'm here with Dr. Kibis from the Department of Information Management and Business Analytics. We'll do a fist bump because we still have COVID-19.
Yes, we're still masked.
Still wearing our masks. We got red and blue. We got opposites.
Yes.
Anyway, we're going to get right into it. So again, the topic today is going to be how can business analytics minimize the spread of COVID-19? Thanks so much for being here.
Thanks so much for having me here.
You excited?
I am. This is my first time being on live Instagram.
Yeah, live Instagram, and the first time in our studio. What do you think?
Yeah, it's amazing. You're doing guys a great job here.
So the first thing, as soon as we get into it, just a general background. What exactly is business analytics?
Well, I believe our students are watching this, and when we say analytics, they probably first imagine a matrix tunnel, right? Like in the Matrix movie, with ones and zeros are flowing in and out. Well, it's not actually what business analytics is. Well, business analytics is the study of statistical methods, tools that can be applied for analyzing data and developing insights that can be useful for managers or practitioners to make data-driven and strategic decisions. So statistical methods, tools, and you analyze data and you provide statistical insights, strategic insights for problems. Now, when we are talking about business analytics, we are actually talking about a wide range of analytics methods. So we have descriptive analytics, we have predictive analytics, and we have prescriptive analytics when we are talking about business analytics. So what are those items? When we are talking about descriptive analytics, we are talking about tracking key performance indicators in a company that will help us to understand the current situation of the business. For example, using histograms or general statistical measures like mean, median, to understand how the company is doing, right? And when we are talking about predictive analytics, we are talking about, for example, trend data or a set of data that will help us to understand or assess the likelihood of future outcomes.
Right.
For example, how can we allocate or locate products in Walmart or in a store that help us to better sell or sell more products? Or how can we make predictions about the future? What will, for example, stock market do in the future?
Right.
And then we talk about prescriptive analytics. It is the last piece of business analytics. And in that case, we use past data, analyze that data, and provide recommendations about the similar problems that can happen in the future and how we can handle similar situations. Now, it will come back to COVID. When we talk about COVID, we had COVID, now we are analyzing COVID data, and for example, we come up with best or better solutions that can happen in the future, and we can now know how to handle those situations.
So what you're saying is not only can companies use analytics,
exactly,
but also nations and worldwide we can use them.
Let me explain you when we first used analytics. We first used analytics during World War II.
Okay.
United States used analytics techniques to understand, to analyze the world geography, and they used analytics to allocate their resources around the world in its bases. So how can you allocate thousands of army members around the globe optimally?
Where are they most useful?
Exactly. So when we are talking about business analytics, we are not talking about only businesses. We are talking about government applications, financial applications, sports. I have students who are currently working in an MBA, currently working in an MBA team. I will not say you the MBA team right now.
Oh, secrets today.
It's a secret. So he's working as a sports analytics person.
Right.
He's analyzing the players' statistics.
That's very cool.
It is. And in finance people, they are analyzing stocks to understand how the movement will be in the future. Or in, for example, insurance companies, they are constantly analyzing their customers' data to understand their risk premium. Or in operations, people are using, for example, analytics to better understand how to allocate, again, the products in stores so that they can better sell the items. Let me tell you a story, Liz. I don't know if you heard about it. Target in 2012 used predictive analytics, and they were on the news in 2012.
Okay.
There was a statistician. His name was Andrew Paul, and he was a statistician at the Target in Minneapolis. And what happened was, the story begins with an irritated father coming to the store, Target store in Minneapolis, and talking to the manager and complaining about the store sending pregnancy advertisements to his underage girl.
Okay.
High school girl. I don't know if you heard about it.
Right.
And the manager, again, apologizes, and he says, okay, sorry about that, we might have had a mistake. And then in the future, some days later, the father calls the store again and apologizes for his behavior because he learns that his daughter is actually pregnant. Now, the store predicted the pregnancy of his daughter way before the parents knew it.
Right.
How did they do it?
With these analytics, I assume.
With tracking the girl's purchasing behavior, analyzing what kind of items she has been purchasing by that time, and sending many products,
so
advertisements.
That's very interesting, but how does this relate to COVID?
Well, now, as I told you, business analytics is the statistical tools.
Right.
It's the methods that we use for analyzing data. You can use statistical methods for analyzing data in businesses. You can use statistical methods and also tools for analyzing COVID data and understanding its trajectory for the future. And how do they do it? Again, we have been talking about data, right? Since COVID started, it's been 1.5 years, almost 2 years.
Right.
And we have been collecting data.
Every day.
Every day. Patients are coming to hospitals. They are providing their names, their intrinsic factors, like extrinsic factors. When you go to hospital, what do? The first thing you do is, you provide your name, age, everything.
All the information.
That's a huge amount of information.
Right.
What we do with that information is we actually collect that information and we analyze that information to make better predictions for future problems,
right,
for future occurrences. Now, how does it happen? Most generally, they collect more than 30 or 40 items about yourself, starting from age, starting from your health problems, your underlying conditions.
All those questions they ask you at the beginning.
Exactly. They do it for a purpose.
Right.
Because one of those items can mean an important thing for the doctors, because imagine that you have thousands of patients talking about, giving their information, and what you do is you put the data into a tool, use statistical methods, and understand the likelihood of having a disease in the future, or if a new patient comes, what is the likelihood of having that patient having a high mortality rate or fatality rate.
Right.
So that's how you understand, how you relate COVID or data analytics to COVID actually.
So this can help. The information comes from the hospitals.
Exactly.
And we've all seen this information, especially during the early days. I know I was refreshing and seeing all of these analytics online.
Exactly, yeah.
So can this also help with distribution of vaccines?
Certainly. So in one of our studies, what we did was, it was during the Ebola time, and I've been working on infectious diseases for a while.
Right.
And what we did was we tried to understand or optimally allocate resources in Western Africa, in Liberia, Sierra Leone, and Guinea. So what we did was we had scarce resources, right? We had couple actually $1 billion, not much. For assume that this is for 3 countries.
Right.
And we were allocating those resources optimally to minimize the Ebola spreads. We were allocating money. We were trying to figure out where to locate our, for example, treatment facilities, where to locate the quarantine facilities, and how do we do it? With the help of analytics.
Right.
Remember, I talked about descriptive, predictive, and prescriptive. When we are talking about prescriptive analytics, we are talking about optimally allocating resources or optimizing the solution for a problem.
And so we can use that for the vaccines.
Exactly. So the same idea. The problem can be different, but the approach is always same.
Right.
How can you optimally allocate? So this is called resource allocation in certain problems. and it can be used. And the same thing happened in COVID. The methods they use, the prevention methods that they use in COVID has been studied for a while. When we were talking about Ebola, we actually analyzed and came up with an idea of quarantining the entire region. The city, the regions, the counties, and the idea that many people came up with, we had the same idea at that time.
Right.
Applied in COVID right now.
Sure.
You know what happened? We stayed at our homes for months.
And
right?
it helped.
It helped. So we put ourselves into quarantine, and it minimized the spread as much as it helps. But it was a step. It was a statistical, basically, outcome that we knew before the COVID happened.
Right. And if everybody followed that to a T, it would have been tremendously successful.
Yes, exactly.
It just doesn't account for that human error.
Well, machines do not count that human error, but unfortunately that happens. Yes.
Right. So we also have to take that into account when applying these analytics to real life situations.
Exactly. So it's always applicable. That's why it is very important.
Awesome. Well, just a reminder to everybody who may have tuned in a little bit late, we're talking about how business analytics can minimize the spread of COVID-19. And if you have any questions based off anything that we're talking about right now or anything about business analytics in general, feel free to leave a comment. It looks like we already have one.
Great.
So I'm just going to read it to you right now, word for word. That's how I do it.
Sure.
What is the demand of business analytics in the workforce?
Well, that's a good question. I was planning to talk about it. So when we are talking about business analytics, we are constantly looking at the Department of Labor's statistics.
Right.
By 2025, we assume that actually it's Department of Labor's statistics. By 2025, there will be a need of more than 300,000 people, workforce, for business analytics.
Right.
I'm not accounting for the financial analysts. I'm not accounting for the other analytics majors. I'm only mentioning the business analytics area. By 2025, it is not far away. It is just couple years. Around 300,000 people are needed in the workforce, and it is increasing exponentially. When a new company comes into the industry, they use data.
Right.
They use data. Let me tell you this. How much data do we produce every day?
A lot.
A lot. Let me tell you how much it is. Remember, guys, when we are talking about storage capacity, we talk about megabyte, gigabyte, terabyte, then petabyte, then exabyte,
right,
then zettabyte, and it goes yottabyte and other things.
Sure, every 1,000.
Every 1,000. So every day we are producing on average 2.3 zettabytes of data every day. Data, Twitter, Facebook, YouTube, everything, emails, text messages, they're all stored somewhere. 2.5 zettabytes means it is around 2.5 trillion gigabytes.
So just to put that into perspective, my phone right here,
it's creating data right now.
It only has about 64 gigabytes of storage.
Exactly. Think about that. So 2.5 trillion gigabytes of data means 250 million libraries of Congress.
Right.
Or 530 billion average song. So 530 billion songs every day. That's how much data we are producing.
That's hard to visualize.
It's impossible.
Right.
It's impossible. So companies need data analysts. Companies need business analysts. You know how business works. You know how to analyze data, make insights out of the data,
right,
and you can combine those information to make data-based strategic decisions. So the industry needs a lot of people in data analytics, in business analytics.
Awesome. And we have another question.
Sure.
This one relates back to COVID, like we were talking about.
Sure.
PMAT1323 says, can business analytics predict COVID variants? If so, why isn't it being used? It seems the variants are discovered when people actually get COVID.
Well, remember, we are using statistical tools.
Right.
And we are methods. There might be error attached to those methods as well. Remember, we are developing the methods.
Right.
And we are coming up with those mathematical models or prediction models.
Mm-hmm.
What happens is they predicted there might be variants.
Right.
But what you do is you cannot know exactly what the variant will be or how fast it can spread. The only thing that you can do is sensitivity analysis. What you can do is, for example, if the mortality rate is 2.5, assume that with the new variant it becomes to 3 or it drops to 1%.
Right.
So you can come up with those kind of scenarios where you can come up with the best case scenario or worst case scenario. But that is, it is just how you approach the problem. You cannot say, okay, we are going to have Omicron and it's going to kill that many people, or it's going to have, this much fatality rate or mortality rate. So you can do it with just doing some sensitivity analysis, with some case study analysis.
Right.
He's right. Again, we have been coming up with ideas of how many people can get sick, and it's our method. So it is a statistical method. You do sensitivity analysis, case study analysis, but they have been using it. We have been analyzing the data since the beginning of COVID, and it had errors because you cannot. Again, we are humans. If we interact more, then it's just increase exponentially the fatality rates, mortality rates. It will change accordingly. So yes, it has been used, and we are still using it.
So obviously we're still using it for the pandemic even today.
Exactly.
Do you think it was and is being effectively used to stop the spread? Or slow down the spread?
It is used to slow down the spread. Could it be used better? Sure.
Right.
But as we talked about it at the beginning of our talk, again, we had the idea of quarantining everyone during the Ebola time. They didn't come up with that idea instantly. They knew that a quarantining people will work.
Right.
So they used it very efficiently. And I'm so glad that they immediately closed on everything. Well, even though people disagree with that, but I agree looking from a statistical point of view.
Sure.
You should quarantine people to eradicate the disease. New Zealand did it very, very efficiently. They quarantined everyone, no one get out of their homes, and they dropped it to 0 level. It helped. At the beginning of the disease, what they did was they collected data and they told that people with underlying diseases, diabetes, lung diseases, they are vulnerable to the disease.
Right.
How did they come up with that idea? By collecting data, analyzing the fatality rate or fatalities using predictive modeling, and they realized that, okay, people with an underlying disease, they are more vulnerable to this pandemic.
Right.
So I can say that it has been used very, very efficiently. Could we use it more efficiently? Yes.
But also hindsight's 20/20.
Exactly. So in my current research, for example, we are trying to understand how we can use the makeshift hospitals. Remember, when the hospitals are overwhelmed with patients,
right,
they open the new makeshift hospitals in many states.
New York City had so many of them.
Exactly.
They even brought the boat over.
Exactly. So, and the question is, did they use those makeshift hospitals efficiently? That's the question.
Right.
Now we are trying to understand again what happens if we have, unfortunately, these diseases will happen very frequently because we have high mobility rate nowadays. And what happens in the future if we have, God's sake, what happens in the future if we have a disease like COVID again?
Right.
Should we use those makeshift hospitals, or how should we use those hospitals?
And many experts predict that there will be more pandemics in the future.
Unfortunately, yes.
Right.
So again, I talked about prescriptive analytics. Now, we are analyzing past data, as you can see, and we are trying to provide recommendations for similar problems that can happen in the future.
Right.
So this is also analytics. Again, we use it during COVID time. Quarantining people was the idea coming from the statisticians, from the analytics people, and from the research that had been done before. And again, in the future, if this happens again, how should we use our resources? Where should we allocate those makeshift hospitals? And how should we use data to basically predict the fatality rate of this disease or any kind of disease?
So let me ask you, this whole conversation about business analytics, COVID, these are all things that we talk about here at the Feliciano School of Business.
Exactly. We have a very well-built business analytics program. We have a business analytics concentration for undergraduate students, and we have a very well-developed master program in business analytics. And we have world-renowned people, faculty in their area, and they are teaching very nice courses, predictive modeling, prescriptive modeling courses, business analytics for optimization for business analytics, statistics, data wrangling. So we have a bunch of courses that will help our students to understand, really what we are talking about right now, and they will be able to understand what's happening in the data analytics era. So I have several students. They're all working in business analytics area. Again, I have students working in the sports industry. I have students working in the financial industry. I have students working in Silicon Valley in big companies, and they all went through a business analytics program with well-known professors.
So if we do have any current Feliciano School of Business students here, are there any courses that you recommend, maybe that you teach or that others teach, but relates to this if they're interested?
Sure. Again, most of our courses, they are taught in the undergrad level and also in the grad level.
Right.
So we have data wrangling course, for example, Dr. Marina Johnson, she's teaching that course, and it's a very important course, I believe, for a data analytics major. We have a text mining class that Dr. Stas Mamonov is teaching. I'm currently teaching data visualization with Tableau, which is a very important course, and I'm teaching optimization course for business analytics students, and I'm talking about how to allocate resources optimally in that course. And we have statistics professors, which is the base of all basically analytics courses. Dr. Serhat Şimşek he's teaching that course. Ram Misra is teaching that course. And we have, again, bunch of professors who are perfect in their area and teaching several other courses that will help our students to get better positions in the industry.
All right. Well, Dr. Kibis, thank you so much for being here today.
Well, it's my pleasure, Louis. Thanks so much for having me here.
Well, we want to have you on again, at least I think.
Well, I would love to be here and talk about analytics, COVID, and other things.
Well, we'll have to talk to my boss. We'll get that scheduled.
Well, talk to our boss.
Phil, you hear that? All right, he's giving us the thumbs up.
Great. Thanks so much.
But thank you so much for joining us today for our last Feliciano Live of the semester. We will be having more, and hopefully the two of us will be sitting in these seats once again.
Sure.
But until next time, this will be the last time I'll be on camera for the Feliciano School of Business until next year. So I hope that you all have a happy holiday season and a great winter break. We'll see you all very soon.
Happy holidays, guys.